Is there a greater risk of complications when performing an abdominoplasty in women who are overweight? Without a doubt, the answer is yes. There is a greater risk of complications when an abdominoplasty is performed in women who have a body mass index greater than 40. Body mass index is only one guide that we use to determine risk in any plastic surgical procedure. Determining surgical risk is much more complex than just a measurement of body mass index. The age and overall health of the individual must also be considered. The definition of body mass index is a number based on your weight and height. In general, the higher the number, the more body fat a patient has. For example, a patient who is 5 feet 5 inches tall has a BMI of 40. A BMI of 30 is considered obese. I personally will not usually recommend an abdominoplasty in a patient with a BMI of 40 or more. There are two main reasons for this. Number one, the risks of surgery are significantly increased. This includes risks such as with anesthesia, bleeding, infection, wound healing problems, blood clots, including deep vein thrombosis and pulmonary embolism. Number two, the result will be suboptimal. When someone is this obese, a tummy tuck will do little to improve their overall appearance of their body. There are alternatives. If there is a large overhanging skin and fat apron, we can perform a procedure to remove the lower skin apron. This procedure is called a paniculectomy. Morbidly obese patients undergo this procedure when the apron of skin and fat is so large that it begins to interfere with hygiene, ambulation, or poses a risk for infection. This procedure is also high risk, but when performed in these circumstances, it can be an acceptable form of surgical treatment. The bottom line is consult with a plastic surgeon to find out if you should be considering an abdominoplasty versus a paniculectomy. Studies have shown a direct correlation between elevated BMI and increased complication rate. For comparison, a patient with a BMI of less than 25 compared to a patient with a BMI greater than 30 revealed complication rates of 9% versus 36% respectively. Obesity in most studies is a significant predictor of postoperative complications. I hope this helps to answer these questions.